The KConnect network exists to ensure that all children in Kent County have an equitable path to economic prosperity through family, quality education, and community supports. Success measures and indicators have been identified to help the community understand the current state and measure the impact of our collective work. Our first success measure on the Cradle to Career Continuum is kindergarten readiness, and the first indicator connected to kindergarten readiness is Born Healthy. The KConnect Journey Map demonstrates the process that the work groups follow to plan and activate systemic strategies aimed at improving each indicator and disrupting disparities. Starting at the measure phase, the prenatal to third grade work group recognized a significant disparity in the birth outcomes for Black mothers. In Kent County, Black mothers are more than twice as likely to have a low birth weight baby when compared to their white peers. This data informed the decision to develop a targeted strategy that would address this glaring inequity. The next phase is engage. In 2017, KConnect convened local stakeholders, including Doulas of Color, midwives, and partners from education, healthcare, early childhood, and workforce development. This group evolved into the Birth Equity Strategy Team. In the activate phase, the Birth Equity Strategy Team solicited feedback from local doulas, parents, and community stakeholders. The input gathered was organized into a strategy proposal that was presented to KConnect's Accountability Partners Council in 2018. After being affirmed by the Accountability Partners Council, the work moved into the build phase. In this phase, the Birth Equity through Doulas of Color strategy was refined and organized as a program pilot with formalized partnerships. Baxter Community Center has agreed to incubate the pilot, and Health Connect One will serve as our national consultant for training and technical assistance. Strong Beginnings agreed to be the primary referral partner, and Mercy Health St. Mary's will be the healthcare system partner. The Heart of West Michigan United Way will serve as the fiduciary. This array of cross-sector partners collaborating to improve a countywide outcome is a prime example of collective impact at work. At this time, the strategy is entering the try phase. The Birth Equity Strategy Team was successful with its first 2 funding requests and was awarded a total of $190,000 from the Steelcase Foundation and the Michigan Health Endowment Fund, which will be distributed over a 3-year period. The Birth Equity Strategy Team will be posting a program manager position in June 2020, and the pilot will launch by August. The next phase is evaluate. Although the initial pilot is designed as a program, it will be implemented and evaluated within a systems framework. The strategy not only aims to increase the number of trained doulas of color and improve access to doula services for women of color in our community, but it also aims to close disparity gaps through diversification of the healthcare workforce and increasing access to culturally responsive health services in Kent County. Proponents LLC will be the third-party evaluation partner for the pilot, and they bring significant program evaluation experience and a strong systems approach to their work. The reach phase is designed to expand and scale systemic strategies that demonstrate measurable success in increasing equitable outcomes. If the 3-year Birth Equity through Doulas of Color pilot is successful, the program will be implemented and scaled in other parts of the community, and the systems level learnings will be shared across our healthcare systems. The final phase is transform. Ultimately, KConnect seeks to create equitable outcomes, eliminate disparity gaps, and effect sustainable systems change. That is the goal of the Birth Equity through Doulas of Color pilot, and it is the goal of all of KConnect's work across the Cradle to Career Continuum. Thank you for being a part of this journey.